I'm Les Rosen, and I've been practicing dermatopathology for 30 years in South Florida. I'm in a group that has about 8 dermatopathologists, which is very helpful, having consultants next door to us with different specialties and different interests. Human papillomavirus, also known as HPV, is very common. We see it in children and we see it in other areas of our body. As dermatopathologists, we diagnose HPV every single day in our common warts that we see in children on the fingers and on the toes. Additionally, we diagnose human papillomavirus on the anogenital areas as well as in the mouth. And it's important to do these tests because the high-risk human papillomavirus infections are associated with malignant transformation or malignant lesions. For example, a high-risk human papillomavirus that we find in a condyloma cuminatum would indicate that this particular patient has the potential to develop a squamous cell carcinoma in situ or an invasive squamous cell carcinoma, be it of the penis, the vulva, the anus, the mouth, or any part of the body, which raises the awareness for the dermatologist to follow the patient more closely or to be a little bit more aggressive in the treatment. We're looking at the same virus that the OBGYNs look at when they do a pap smear. However, in dermatology, dermatologists don't do pap smears. So they're seeing the human papillomavirus present on genitalia, on the mouth, on the fingers, and in other parts of the body. And it's important to know if we're dealing with a high-risk human papillomavirus because they can treat these patients way more aggressively and also the partners of these patients. As you know, you see human papillomavirus infections on the skin as dermatologists. And sometimes clinically, the lesion of human papillomavirus, such as the condyloma cuminatum or Bowenite papulosis, be that as it may, can mimic clinically a seborrheic keratosis or an acrocorridon or skin tag, and therefore you need to biopsy to rule out the presence of or absence of human papillomavirus. And that's where we come in and work together, because it's important for you and for the patient, more importantly actually, to know whether they are carrying or have human papillomavirus. And the only way we can do it in dermatopathology is to use our DNA probes that we have available. As a dermatopathologist, we receive biopsies from dermatologists as well as other specialties. However, when it comes to the condyloma cuminata, if I can make the diagnosis under the microscope without any special stains, I will make the diagnosis. When I make the diagnosis of condyloma cuminata, I always put a note in the report stating that we can do high-risk testing and low-risk testing to take the pathology report to a different level. This can be generated by me if I'm not 100% sure of the diagnosis, or by the dermatologist who can request it if necessary. When the dermatologist gets the diagnosis back that it's positive for high-risk human papillomavirus, they are usually a little bit more aggressive in the treatment, and they have to follow the patients way more closely for the potential development of squamous cell carcinoma, be it in situ or invasive squamous cell carcinoma.